Good afternoon from Colombo, Sri Lanka. I'm Dr. Pramod Amarkon from Health Informatics Society of Sri Lanka. We warmly welcome you to the second Sri Lankan eHealth Hour organized by Health Informatics Society of Sri Lanka in collaboration with the Asia eHealth Information Network. We are honored to have with us today the President of Health Informatics Society of Sri Lanka, Prof. Vajra Disanayaka, and the Executive Council members of eHealth. We would also like to welcome Ms. Teres from eHealth Secretariat. We are delighted to see several experts of health informatics, including medical officers of health informatics, academic staff of universities, as well as postgraduate students in health informatics joining for our webinar today from all over Sri Lanka. And also not to forget the attendees from the countries of Asian region. Thank you all for joining. Sri Lankan eHealth Hour is an online knowledge sharing session where experts in health informatics will be sharing their knowledge and experience on topics of interest in real time using WebEx platform. We will be usually having a presentation by a panel of experts followed by a question and answer session where attendees can actively involve. Sri Lankan eHealth Hour will be held fortnightly on 2nd and 4th Thursdays of each month between 12 noon to 1 p.m. Before moving on to today's session, I'll briefly mention a few things to remember while using WebEx platform. Once you have logged into WebEx, the left panel is where you see the content presented by the panelists, including PowerPoint presentations and videos, etc. The right panel contains some useful tools. If you click on Participants icon, it will display a list of panelists and attendees currently logged into the event. Q&A button can be used to ask questions from the panelists. You can also provide feedback during the presentation by clicking on applause, yes, no, too fast, too slow, and laughter buttons. Please note that your microphone will be automatically muted once you join as an attendee. If you encounter any issues in receiving audio during the webinar, please log out from the WebEx platform and try to relog in. The topic for today is how to build a social media and web presence for a professional medical association by Dr. Rikas Sharif. Dr. Rikas Sharif is the medical officer of health informatics at the National Institute of Mental Health. He plays a facilitation and leadership roles in the use of ICT in the healthcare sector and in managing health information. Rikas is a life member of Sri Lanka Medical Association, having served in the capacity of Assistant Secretary and Council member from year 2012 to 2015. He is also a Council member of Health Informatics Society of Sri Lanka and was also a Council member of the Forum of Sri Lankan Medical Educationists from 2012 to 2014. Rikas holds an MBBS degree from Bakai University in Pakistan, a postgraduate certificate in medical education, and a master's degree in biomedical informatics from Postgraduate Institute of Medicine, University of Colombo. And we are lucky to have him as the panelist for our inaugural Sri Lankan eHealth Hour. Over to you, Dr. Rikas.
Thank you, Pramod. I hope you are able to see the presentation.
Yes, Dr. Rikas.
All right. Thank you very much. I think I'd like to start actually by thanking the President of the Health Informatics Society of Sri Lanka, Professor Vajra Disanayaka, as well as, of course, the President of the Sri Lanka Medical Association, Professor Jennifer Berra, who has also been told about this presentation, and of course the Asian eHealth Information Network for giving me this opportunity to speak a few words about a subject that I am passionate about. This presentation will hopefully shed some light into how any professional medical association could go about setting up an all-round information service for the benefit of your membership. as well as give a glimpse to the public of the workings of a medical association by using web and social media. Now, before we start, I think it's very important to give an outline about what we are going to do today. I think we should start off, of course, by the existing situation of the SLMA in terms of online presence in late 2011. The SLMA is in any case the umbrella medical organization for the country. So we'll first look at that. Second, let's go through a few brief steps as to how to convince an unsure council or board of your organization to venture into these new technologies. But that's a reasonable thing. I mean, we being digital immigrants or even digital natives may feel every online initiative is a good thing. But what was our justification for turning to these online platforms? Was it even needed? Did it fit into your association's objectives? So you will find that in certain instances, you will see it's quite easy, and in some instances, it may not be so. Third, we would like to share with you the methodology we used in creating a sort of, I would say, conveyor belt of processes, which started from random medical news from various parts of Sri Lanka to it being promoted via email, web, and social platforms, basically through Sri Lanka and the world. Next, I think it's very important since the next part, because I think a lot of us want to actually have an output like this in a presentation or form of research. So the next part is, of course, to understand how we can use these tools, these online tools to get analytical data. I think the doctors are quite used to working with data, so they want, I'm sure even in the online world, we need data. So there's a gamut of tools online which will allow us to analyze the effects and impact of these online initiatives. And of course, it's very important to remember that in all endeavors, there are going to be some bitter truths. So we would like to share some of those as well. Right? And of course, finally, how we are going to round up and move forward in the future. Now, looking at the SLMA situation in late 2011, the SLMA had already stepped into the digital arena with the advent of the SLMA Medical Informatics Committee in 1997. I think at this point it's very important to note that our current HISL president, Professor Vajira, was one of the founding members of that committee, and that could actually eventually grow into HISL as we know it today. They already had a website and official email. The Ceylon Medical Journal was already online, but apart from that, there were no major initiatives, I would say, in the form of mailing lists, social networks, online newsletters, and these sorts of things. I think the first lesson that we learned during SLMA and under Prof. Vajira and Secretary Dr. Lasantha Malavige is the real requirement for planning well ahead. And I think this is important because most of the time when you take over, when a president or a secretary or a council takes over an organization, typically the inauguration ceremony is at the start of the year. So when it comes to online initiatives, it's not that easy because as the ball is rolling, as you start, you have to have your online initiatives in place. So I think this was a very important thing that at least 3 months before the presidential year, Prof. Vajira, Dr. Lasantha Malavige, myself, Dr. Deepal, Dr. Prasad Rantham, there were many others, actually got together and started discussing how we can change this idea about the SLMA, because SLMA at that time was not completely online, and how can we change the attitudes of our membership towards an online type of working environment. So that was the first important thing. The next thing, of course, is building a team. We all obviously realize that we will not be able to do everything. After all, we are all doctors, although we have health informatics background. So we did employ the services of professional web designers for the IT work. In addition, of course, we are very lucky because in Sri Lanka we have a lot of officers, I think nearly 70 now, who are qualified in health informatics. So in addition to that, the health informatics doctors who have skills in various areas like HTML, publishing, social media, corporate planning, and these sorts of things were made part of the team. We also kept the in-house staff. Now we have general clerical staff in the SLMA. We also kept the in-house staff informed of the coming activities of the year and gave them training on the online methods we were using. So that was very important, because sometimes now at the higher level we do a lot of things, but then the people who collect the emails, talk to the consultants are not the doctors themselves. It will most of the time be clerical staff. So you have to get them involved in and make them part of the team and make them part of the process. So one of the things is by giving them a short training on what we are doing, they felt part of the team. And we felt this was an important step in the change management of this organization. Another good thing we did, which is of course I think today a lot of people do, but still it begs to be told again and again, is to minute everything, because I think every single meeting and idea we never took for granted, and actually we found that sometimes things we had talked about 2-3 months back were actually the things that we were going to do right now. And finally, in our planning stage, I think we thought of a comprehensive online cover. Our theme in that year, 2012, was Global Forum of Sri Lankan Doctors, and we were determined to use as many platforms as possible. I think any association thinking about starting up online would need to think in similar lines. This tradition, I'm very happy to say, after Prof. Vajra also, the other consecutive professors, Dr. B.J. Pereira, Dr. Palita Bekon, and Prof. Geneva have all continued this tradition of the online search in the SLMA. I think the first good practice point is this: justifying your initiatives with existing organizational objectives. Now, because the question is this, and it is very fair to ask, why did the SLMA go to all this trouble? Anybody can ask you this question. Is this activity, the online activity, even in line with the association's objectives? These are very fair questions. This needs to be answered early, as we must remember, not all councils are full of digital natives or digital immigrants, people who are working with technology. We need justifiable reasoning to sway the vote among those who we can consider digitally challenged. So that is very important, because every council needs to be convinced that this going into this online forum and exposing the SLMA or any organization is worth it. That is, the return is worth it. So in our case, of course, the answer was easily found in the SLMA corporate plan. It is currently under review of 2009 and 2012. And in that we have clearly have a mandate, because we had under that corporate plan, objectives 3 and 5, we said that we have to promote professionalism, good medical practice, and provide opportunities for continuous learning among doctors. And indeed, these online initiatives definitely do that. Looking at the word continuous learning, we can further appreciate online continuous learning by the fact that, to borrow a phrase from maybe e-learning, is that these will become reusable learning objects in certain instances. Like let's say we put up a video on YouTube, which is actually a presentation, then that becomes something like a reusable learning object. So that is a very important thing which occurred by looking at this corporate plan. Of course, then we look further, you can see that objectives 7 and 8 also are quite important. It indicates the SLMA's need to educate and tie with the public and allied professionals respectively. Because we have to remember that public online platforms such as Facebook, YouTube provide learning to medicos and non-medicos alike. We cannot restrict it purely to medicos, because social media by nature is a public affair. It was in the same spirit that when looking at the SLMA's mailing list strategy, which we will discuss later, that it was decided to include not only medical professionals but allied professionals as well, who could also keep up with the latest medical news and events going on in Sri Lanka, even though they may not necessarily attend them. So the answer to the topic of this slide would be an emphatic yes. I suggest this sort of inclusion in our attendees association's objectives. I think it's essential to move ahead, because only doing this as an endeavor, as an operational endeavor, is not enough. This needs some sort of strategic notation in the corporate plans or in the objectives of your respective associations. Another important question is, does Sri Lanka have an adequate online community, let alone an online medical community, to justify these initiatives? This could be asked by your council member. So we have to consider the internet penetration. So in Sri Lanka's case, the internet penetration rate is roughly about 19%. That's more than 2.5 to 3 million people. Out of this, since we have analytical tools on the social media side, we can also say that 46% of these are on Facebook. In addition to this, we also have the emerging mobile internet crowd. So we know that Sri Lanka's mobile phone penetration is an excellent 100%. In fact, I think there are more mobile phones than people in Sri Lanka at the moment. And if you look at this, we roughly know that smartphone penetration is about 15 to 17%. So if you add to this that mobile internet has already taken over regular internet as the number one access method to get onto the internet, then we had all the motivation we needed. These statistics were collected from Facebook as well as internetworldstats.com. So when we started off, we had a few goals. One of them was to get as many medical professionals subscribe to our email list. Now, this is something we have to discuss a little bit more in the next slide. The next one, to create an easy way for all sizes of associations to disseminate the promotion that they require in order to fill up their workshops or fill up their seminars. So it was one of the goals of the SLMA to do that and make sure that even the small associations or forum also get promoted through this way. Another one was to increase awareness in the CPD activities going around the country, because I think it's very common, even probably in the other countries, where they say, I didn't know that CPD activity was going on, nobody told me, and this sort of thing. So we wanted people to have one way in which everybody could say, look, are you on this mailing list? If you're on it, or if you're on the social platforms, you will definitely be informed about it, right? And another beneficial advantage of all of this was that we were able to give the general public a positive impression that health professionals are continuously involving themselves in CPD activities via the social media channel, because I think that was just an additional benefit that we discovered, because we found that people were not only medicals, we found that non-medical people were also interacting with these platforms. I think this slide, I just wanted to add it because just to give an idea of roughly the type of things that composed of the elements of this campaign. I think the most important core was the email mailing list. I think the email mailing list was actually a collection of emails from various associations and societies in Sri Lanka, which was initially collected by Prof. Vansida, and then slowly this expanded. And this was the core of the work at the start, the email mailing list. We also had the SLMA website, which has now recently been redone very well in 2015. Then, of course, we had the social channels, which we developed ourselves. We had to start fresh with Facebook pages, YouTube pages, Twitter, and these Twitter SMS, things like that. And one of the things that we added to the email mailing list was producing an electronic bulletin, because I think all associations probably have a newsletter. So we produced a type of electronic bulletin which collects all the information from around the country, which is sent by various associations. And another thing which I would also like to mention is that there are certain publications which cannot be sent via the electronic bulletin, because naturally it's too big and it cannot be put up and read in a day. So we have another area for this called the ISO. I think this is a famous publishing platform, and we had other publishing platform on that called Sri Lanka Medical Association online library. If you go to issue.com, you'll be able to see it. And this was a place where we uploaded things like the vaccine information, things like for example, treatment of bends, all of the Sri Lanka Medical Association newsletters. We have the published newsletter which we print. So in addition, for the benefit of people who cannot get the print, maybe they are abroad, they were able to view these things, and actually we have a huge count. I think it's more than 300,000 views and multiple downloads. So it's active place. This issue where the publications are occurring. So these are roughly the elements of the social media campaign. Another very important thing, I think this is again a good practice point that we discovered, that initially when we started by collecting emails. That is, we contacted associations and said, look, we are starting an email list. So for the benefit of the medical public, of the medical professionals, so would you be able to share your association's list? And we started with this methodology. But after a while, we realized that although this was done in good faith, and that was the only reason it was done, the fact that this was not customized email solution in the sense that I think today in the modern world we know that email has an opt-in and an opt-out method, and there's something also called double opt-in. Right? So opt-in is where you go to a website and you put your name in and say, look, I want these newsletters. And opt-out is you might, even though you may be a doctor and you do want to be updated, you may not really want to be part of the SLMA validity, so you want to opt out. So we realized that these initiatives were actually not there because we started off with basically just a mass mailing, bulk mailing software. So later on, we migrated to a mailing software called MailChimp, which gave us the freedom for subscribers to change their email or subscribe or unsubscribe. So therefore, one practice point we can say is collecting emails is good for the short term, that is linking up with your associations and member organizations is good, but over time you will have to realize that you will have to create this double opt-in method on a website, which is basically having a web HTML area to add your name and maybe your email address, and then it will confirm it with you on your email account, and then you will be a double opted in subscribe. I think that's a very important point that we learned. And actually what that has done is, it has given a very stable subscriber base for us. Now for the last about a year or so, we've been on this MailChimp service, and we can see that while there is some growth in this mailing list, we don't see any huge unsubscriptions or complaints or anything like that. We find that the stable subscriber base is slowly growing, if not stable. Another a good practice point that we found while doing this is that associations keep on sending us information, but since they do not have any guidelines, they send information in various ways. First problem, of course, is the source of information. Naturally, you might find a president or a secretary who is very busy, might just call us and say, look, I'm having this very important workshop maybe in about 3 days. Could you just write this down? And so just we might be forced to write it on a piece of paper. So and of course there can be spelling problems. Then sometimes the files may not be easily readable. It might be errors in that. So to sort of regulate all this, we realized that we needed to give some guidelines. So around 2013 or just late 2012, we launched this publishing guideline. It's available on the SLMA website, and it gave certain guidelines as to how to give information to the SLMA. This is just one of the things about how we expected information that we accepted to publish. Now, every type of information was not going to be published, so we said over the phone is not going to be accepted, and things like this, and what sort of file formats are acceptable. If a person wants to advertise, for example, let's say another medical association wanted to advertise their sessions, what could be the guidelines for that, things like that. So this was very useful and always gave us a reference point. Right. So then, of course, this we talked before about the conveyor belt of processes. So now we have to see how do these all fit into one harmonious cycle. I think we start off by using our own news and receiving news from outside. As of this presentation, nearly all major colleges and associations have benefited by setting news via this search. Each news item has to be ratified. That is, it has to pass the guidelines set in a website to be accepted by the bulletin search. You would be surprised even basic things like dates sometimes missing. Also sometimes there are problems in that. So because of that, we have this ratification method. So the first thing that happens is the news will be uploaded to the website. Now, before we start spreading this news which we have uploaded to the website on the email list and the social media, we will now convert this link into a trackable link. Right? That is there. So we convert it using a software called Bitline. We'll talk more on this later. Now, what we do is a brief snapshot of this news item with the bit link is now published in one click to Facebook, Twitter, and LinkedIn. We use a social media tool called Buffer. Buffer is an application which allows us to link all the social media tools together and publish in one shot. Now once the social media tool is done, we now get on to the process of producing the bulletin. That is the, as I said, the e-notification bulletin. So the bulletin is then produced in HTML format, but it's a very shortcut HTML format, as you will see now in the next few slides. The bulletin, of course, once it's published, it just does not get published like that. Just like a journalist needs to be vet all his documents to the editor, in the same way, we have a moderation committee which generally composes of the president, secretary, and another very senior member. They go through the links and they see whether that conforms with the guidelines of the SLMA, and then only we publish this bulletin. So this is the general production cycle which we have been maintaining for quite a long time, and it's quite useful and quite easy to use. And so final product, of course, is that there would be a bulletin like this as you see on your screen or in your inbox with the links and a very short description about the event, and then of course it gives the freedom for people to choose what they want and click and go to those particular areas. So inside that, you would have noticed that we have another area called bulletin, making a bulletin. So the making a bulletin itself was another small activity in itself. The first thing that we had to do is prepare the news item to be published. As I said, associations will give these news items in various formats, and therefore we have to make a special effort to actually convert it either normally convert it into a JPEG, because JPEG is not editable and therefore it's easy. So we ask the association also to send us in a JPEG format if possible. And then of course, as you know, we said we upload this news then to SLMA.lk. The most important thing here is the JPEG part, converting it to the correct format. Then the next thing is we have to prepare this bulletin. Now this first, I think that the three bullet points or circles you see on the right you already know. But this part is where we use a simple tool like Microsoft Word. Now we did this and we produced the bulletin through Microsoft Word. So that might be something that might be a bit surprising to you, but we did it because we expected, actually we do expect even over time, that even a regular person, a person having an association having not much experience in producing a bulletin would definitely be knowing Microsoft Word. So it's just a small step up for the person to know a little bit about HTML in order to produce a bulletin using Microsoft Word. Then once we produce this in Word, we save it as a HTML file if possible in Microsoft Word, and then we would get on to editing it in a HTML software called Composer, because as you saw in the previous slide, there were certain small pictures to attract the news item. So those cannot be done through Microsoft Word. Those you have to do in a HTML Composer. So we use this free software called Composer with a K, and it was very successfully, it was able to do that. Then once we did this in Composer, since it's a HTML editing software, naturally the code is available. So once the code is taken, the code is copied to our mailing software called MailChimp. And this MailChimp software then basically can be sent to the moderators to be checked, and once they are happy, can be published. So this is a mini cycle inside the major production cycle of the bulletin. I'd just like to show you in pictures how how interesting and how simple it is, the method we have made to simplify to do this e-notification bulletin. First of all, you can see this is basically a Word document, and we have made this sort of frame for the Sri Lanka Medical Association e-notification bulletin. On the left side is the thumbnail picture, on the right side are some sort of news. We have a top news is for SLMA, and we have a bottom area for the medical news for notices. So this is first made and then saved in a HTML format. The next stage is where we go to we save the HTML format, and then we see the same thing now, but of course now it's being edited in the HTML software called Composer. So under Composer, naturally Composer is a coded, is a software which is running on code. So we'll be able to go to the code part of this and then copy this code. Now you can see that there's a lot of clutter, but MailChimp is able to sort this out, and when we copy this code into MailChimp, you can see that it's still able to take all these code and make it into a very presentable bulletin. So that was just a small picture. I would have loved to done a demonstration of it, but since there's no time, that was just a picture view of how we did it. Now, social media is another thing that we also publish. I said before we publish via Buffer, and we used to post quite regularly. Now, there's a reason for that, because I think if we read the news about social media, we find that over 90% of fans who come and visit your Facebook page actually never visit your page again, and only see your news if it is ranked in their post. So therefore, posting regularly is vitally important. This sort of reach is called organic reach, and Facebook has been gradually decreasing this organic reach for commercial reasons, because they want us to pay and get this reach. We also set up this to post automatically to Twitter. This was, as you know, that Buffer is also posting to Twitter. But since Twitter has very limited character set, it's a very good idea, again, it's not a good practice, right? That we have to put the initial important information at the start of the Twitter tag, because maybe the first 100 characters, you have to learn how to write short and brief introduction. Maybe when you want to write about the events, about the time, date, place, you might have to be very short and sweet about. So also we had another very important thing was a posting policy. I think when you're in the social media world, you will find that everybody is not there to learn and to use the social media tools in a responsible way. Sometimes you find people are very colorful and put colorful comments. So we have very clearly in our Facebook page have something called a posting policy. You can go to our website facebook.com/SLMA online. If you go there, you can see under the About Us, we have a posting policy about what we expect the conduct of the fans to be, but we do not press on it, or we do not keep on publishing it. We just have it, so in case people do make a fuss, we have a policy in place. So over the years, we've collected about 30,000 fans across all this media. You can see this is a snapshot of that of the page which is currently running. Another very important thing, I think this is relevant for all social media, not only for Facebook, but this is the now actually outdated Facebook Edge Rank method, and it shows about how the social world ranks your post and what sort of news you need to be. So the first thing is affinity. Affinity means how relevant is this post to the cohort of people. Now, let's say you're giving it to a doctor. Naturally, if it's highly medically relevant, it's going to be shared among his colleagues. Then the weight of this type of post. So the post should be attractive enough to convey that it is a very important post. That's also very important. And of course, decay. Decay means we should be very prompt in our posting of news and information. Now, let's say you have a news, you have an event which is going to happen in 6 months. There is, of course, even it makes sense that there's no point in publishing it and posting it and promoting it 6 months before, but maybe 2 months before, 1 month before, and you build up the crescendo, and people will realize that this is something that's going to happen very soon, right? But today we cannot be so naive as to think that there's only 3 things that rank a Facebook post. Very recently, in interviews with Facebook, they say that there's more than 100,000 ranking factors. So just to give you an idea, Google has only 200 ranking factors. So you can see that Facebook has evolved a lot in what it considers relevant and what it considers not. But those basic 3 rules about it being relevant to the audience you are sending it to, about it being an important post, very properly designed so that important, and also it should be timely. So those three things are still, of course, very important, but it's much more complicated now. YouTube, of course, I would not try to dwell too much on, because it was actually it's just a work in progress. Since we do not have a video editing team, we do not have much links on YouTube, but we do have certainly very important key lectures by our senior SLMA members, and we have about 11,000 views on our YouTube channel, as well as about 50 subscribers. Now, the most important thing from all of these methodologies that I think we have learned so far is, what did these efforts mean? Because that's very important. Did people read our posts? What sort of information can I get from the online platform? So the answer is in the vast array of online analytic tools available. So we shall concentrate on a few. The first thing, of course, is the general observations. I think this is also very important. I think membership in attendees, in email subscribers, and also visit website. These are basic things. Especially, I think it's very important to keep track of attendees and also have some sort of statistical report on workshops that happen that actually published on the online presence, on the online email subscription service, so you can see how these increase. So these are the general observations we made. Another very important thing that we use is the link tracking, because there was a lot of questions being asked by the membership as well as our council. First question is, are Sri Lankans clicking our links, or is it some spam? From a distant country, today we know that spam is a big problem. From where are these clicks coming? People were curious, are these Sri Lankans, are these British people, who are these people? And how much is social media contributing to the flow of traffic to the website? So how we did this is, we used the tool called Bitline. So I think I'll show you a snapshot of this. This is actually the SLMA's own Bitline, and this is one of the links that we posted. So immediately, since the URL was shortened into this type of shortened link format, so when a person clicked it, whether he clicked it from email or Facebook or Twitter, it was very clearly seen from where these people clicked. I unfortunately do not have there was another slide which actually talked about the types. You can even check, you can break it down into time. So you can see what time these clicks are occurring. And sometimes we found that emails we may be sending in the morning were actually being clicked in the evening. So these sorts of things happen. But generally, we found that if you posted correctly, and generally there are some research that says that if you post late morning, it is beneficial as well as late in the evening. You find that the clicks are generally higher right as you post it. So timing is very important. In the same way, just like this link shortening tool, Facebook's analytics is no different, allowing us to precisely track what sort of demographics our population is. So here you can see that from the Facebook analytics, you are able to find out what sort of statistics about from where, what was the male-female ratio. In this case, it was 2 to 1. And we also found out that even though we have a very small fan, we have 13,000 fans, potentially it can reach 100 people through the friend channel. Right? So these are some of the analytical tools that you can use under Facebook Analytics. You can see the total reach of your posts. Over time, you can see it's gone down a little bit because, as I said, the organic reach, since we are not continuously spending on, we actually initially in 2012, we did spend some amount of money to build our fan base, but over time, since we cannot sustain that sort of social media spending, we have now gone for more organic. So organic reach, as I said, Facebook is reducing the organic reach. So therefore, you find a little bit of the post visibility going down. So this sort of analytical tools are available on Facebook. You can do a complete demographic study of your followers, from what countries are they from what cities are they from, what's the agenda, and things like this. You can even track what sort of times they are online. So these are all available under the Facebook Insights module under each Facebook page. Again, it also provides very good statistics about how the views are coming, and I think the most important takeaway point here is that even in the SLMA's YouTube experience, we find that 15% of the views were coming from mobile. So then that immediately makes us think about the 5-inch or 4.5-inch screen that a mobile user is going to see these presentations. So we have to, of course, that immediately gave us a clue that presenters have to be informed that the font sizes of their presentations will have to be quite reasonable in order to get a good viewing experience. Here I would like to show in this slide the importance of posting frequently. So you can see that in the early part of 2013, you can see more condensed lines, and you can see the line, the axis shows the number of views, while the other axis shows the number of the timeline from 2000. I think this fact is a little bit old. It's 2014, but you can see at the start actually we used to post very frequently, but then due to time constraints we started posting regularly on a Tuesday, Wednesday, Friday, like that. Although we started with the daily post policy, due to time constraints we could not do it. So then we started posting more regularly, but with intervals. You can see that posting more regularly in the left side certainly seems to have benefits, but posting I don't understand it. Let me see. I think what I am talking about is this area here on the left side. You can see more posts, but you can see if you are less posting, the reach is going down. Another important thing is time of day, because what time of day would do better. We found that while I think the previous research also said in other sites that more posting in the morning at 11 and posting in the night right after work in the evenings is beneficial, and certainly that seems to be the same case in our case as well. A very important question that was being asked by many is this post reaching Sri Lanka? So fortunately, due to BitLive, Facebook analytical tools and these tools, we were able to categorically state that nearly 90% of the people were actually Sri Lankans who were viewing all this content. So that was very important, because at that time our theme was Global Forum of Sri Lankan Doctors. So we wanted to reach Sri Lankans. So we had achieved that goal, and it was definitely well in line with the theme of that year. Another interesting thing is, since we are now posting in these categories, actually there is different categories of posts that come. Medicine, there are some workshops which are medical in nature, some obstetrical in nature, pediatrics, and so on. So we were able to then analyze and see what are the general views across these categories. And so you can see that most of the categories have a very good reach right throughout. So I don't think we can, although surgery seems a little bit more than the others, I don't think we can look much into it, but still you can see that all the disciplines were viewed. This is also another issue, because since the SLMA was an email bulletin service at its heart, and therefore it had the non-SLMA post, a problem that crops up is, do the non-SLMA posts do as well as the SLMA post? So I think this graph is a very good indicator of that. Because of the fact that we have this BitLive and link tracking technology, we are able to show very clearly that the SLMA posts actually don't do as well as the non-SLMA posts. So we can see that the SLMA posts actually do less than the non-SLMA posts. So of course all these statistical tools finally allow us to do a much more thorough analysis of the type of conversions that are occurring from email and social to the website. So we can now, this is the total bar, that is blue, red, and green, represent the total type of views we are seeing on the website, right, in a particular month. And since we are able to now break this down through BitLive and Facebook analytics tools and among various others, we can see what is the contribution of different media, that is email, organic. Organic means people coming to the website directly and checking to this post. So you can see that email has played a very important role in bringing people to the website, but social has played a very small role. But but an interesting thing occurred, which gives more credibility to the fact that the email list is at the core of bringing traffic to these news and events and making people read them, is that first of all we found that social reach went down. And as I said, we already know this established fact that organic reach for social media pages was going down. But an interesting thing happened, that we had a disruption in our email service in March 2014. So you can see that although the statistics show that the email percentage of traffic is low, but in actual fact, even the organic traffic seems to have had some disruption since the email service also got disrupted. So therefore, it's not, we cannot purely dig into this, probably it needs more study, that the disruption in email service was having a direct relationship with the organic reach of the website. Then of course, Facebook also brings up some interesting things. Since Facebook is a social media page, it also can bring up things like social activism. Now, this was a very interesting thing that happened, I think, in 2013, in which a doctor was attacked. So what happened is we also, the SLMA felt strongly about this, and the SLMA actually put up a post regarding this doctor's attack on the social media page. And you can see that although generally our doctors are not that active on these sort of academic social media pages, we found 104 shares very quickly because people were to show the support for this attack on this doctor, just to give you an idea of the type of social activism that can occur. Another interesting thing is naturally you're dealing with the customers or rather your patients. So they also come up on and come and tell about the what type of community initiative. Now we have something called SLMA Run and Walk, which we've been doing for a few years. So this is one of the people who went there and saying that he can't barely move his legs and that. At the same time, we sometimes get complaints on this, very reasonable complaints here. I think one of the SLMA was housed in a house of a famous doctor, Dr. E. Vijayarama. So one of the grandchildren here is saying that he couldn't find his grandfather's name in the website, so we clarified it. So these sorts of things are the great positives that you find in the social space, which you cannot find in the maybe in the email space. You cannot get it much. So the social space gives all these sorts of things. So the positive effects are that we developed a large email list, we developed a reasonable gathering of followers on the social media and these views, but the most important and telling thing was that the average attendance in workshops definitely increased. Unfortunately, I do not have a statistic to share with you, but certainly we have got numerous calls from many workshop coordinators saying thanking us for these workshops being posted on the email and the social media, and that these increased. The scientific sessions also went up a lot. So therefore, we found a very big increase. And I think one thing that we could not emphasize here is that the very culture of the SLMA also changed, because we are after all we are after all very sort of analog type of institute, but it became digital after these initiatives. So the conclusions are that the social channels and especially the email channel seems to be directly associated with web traffic. I think we can see that the posts were fairly well viewed, whatever the discipline, and the SLMA and the non-SLMA news was well viewed. So you can see that that's not going to be an issue, even if you are doing this sort of multi-association type of bulletin service or web presence. So I think some of the recommendations that I should give finally is that building rapport with the professionals and public should be definitely in your corporate objectives, because once you do that, it's very easy for successive presidents and successive secretaries and councils to continue the good work that you are doing. Right? The annual budget should definitely have a place for IT and social media. If not, you might find it difficult to get budgets in certain times. I think a very good website is and very reliable email solution is a part and parcel of this whole campaign. Hiring a person confident in the IT in your staff. Now we have a new staff in the SLMA called Tarindu, is doing a good job. So that is very important. And certainly having council members, in the case of the SLMA, I think they always get some officer in health informatics, but what we're trying to say is that having council members who are having IT savvy skills is excellent and essential to go forward. And of course, training your in-house staff is also something that we also did, an experience and good change management. Having clear email and social media policies are also important. And analytical tools, certainly I think having all these link tracking tools was very, very important. And one thing that we could not touch on here is that although we were doing all this, all of us are busy professionals, so learning to use your smartphone to do all these bulletins and to do all these, especially the social media management, is very difficult unless you can do it through the phone. And finally, I think if you are doing social media initiatives, you should have a fun element in this, because if you are thinking that this is 100% serious, it's going to be quite difficult to do social media. And just to finally round things off, I think that some things that we did not talk about is things like advanced analytics through things like Google Analytics, up and coming social media platforms like Instagram, Vine for 6-second videos, and things like WhatsApp, which are now becoming very popular. And of course, streaming lectures, as the next platform has done, and we have done now, is also something that we should do more in the future. So I think the final takeaway point is that all these efforts should ideally to a medical professional attending a lecture online and earning a CPD point on. I think that's the ultimate goal. I think that all of these efforts should finally lead to a doctor actually attending a CPD lecture online and earning a CPD point. I think that's the final goal of this complete enterprise. We are also in the SLMA still trying to reach that goal, but we haven't given up. We are still going on that goal. Finally, my thanks, of course, I should have to thank the SLMA president and the team. Have done a great job. I think it's nothing done on my own. With that, I would like to conclude this presentation. Thank you.
Thank you very much for the very informative, elaborative presentation, Dr. Rikas. I'm sure our audience must be having a lot of questions to clarify from you. Please use the Q&A box on your right panel to type in your questions. We will try our best to accommodate all the questions. We can also provide a facility to ask the questions using voice, provided if you have a good internet connectivity and a minimum background disturbance. Please mention in the Q&A box if you are available for connecting via voice. We are really glad to have a variety of experts in health informatics joining with us today, including participants in field of IT as well as from major telecommunications companies of Sri Lanka. We would also be grateful if you could also submit the feedback form we will be sending to you via email after this webinar. We will also be forwarding you the presentations done by Dr. Rikas to you after the eHealth hour. We have few questions already asked from the audience, and before that I would like to mention something Mr. Samira Vijayaratne from Dialogue has mentioned here. He has mentioned in year 2011, 4.2% of the Sri Lankan population is on Facebook. The source is ITU, and also 50.3% of the Sri Lankan internet users are on Facebook. And in year 2013, 11.5% of Sri Lanka's entire population is on Facebook today, with 1.4 million being male and 720,000 being female. A few new facts for us. And with that, we will move on to the Q&A session. And the first question we have for today is from Mr. Suchit Tilakaranthan. He asks, could you explain what is meant by double opt-in? Dr. Rikas?
Right. Hello, can you hear me?
Yes, we can hear you loud and clear.
Yes. So yes, double opt-in actually is a very simple thing. Now, what happens is normally when you are collecting emails, one of the methods is double opt-in. Double opt-in means there are two opt-ins. That is why it's called double opt-in. The first opt-in is where you tell a person, for example, a person comes to your workshop and is signing a form. Then you say, would you like to be part of the SLMA list? He says yes. So you don't write his email and put it into the email list. No. What you do is you tell him, please go to slma.lk and you will see a form there, fill it up. So the first part of the opt-in is he goes to the email address. He goes to that opt-in page to go to the SLMA, you'll be able to see it. And once he goes there, he writes his email. So that's the first part of the opt-in. Then the system, actually we are using MailChimp. So what MailChimp does is, it sends another email from the MailChimp server to the email of that person and says, you have recently put your name up for registration to this email service. Would you like to be registered? Please click and confirm. So when you confirm that, that's the second part of the opt-in. So the double opt-in process has been proven to be a better method and brings more sustainable growth to your webinar, to your subscriber. I can see, I think we showed you a slide before where the subscriber base in SLMA has hardly changed. It's slightly grown. It is hardly changed. I mean, it's not been unsubscribed. So that is the double opt-in method.
Thank you very much, Dr. Rikas. The next question is, it has been asked by Ms. Nadika Shamali. She asks, how do you overcome risk of getting marked as spam when using bulk mailing software?
Exactly. I think that's a very good question, Nadika. Thank you for asking. I think the most important thing is using very good mailing technology. I think when we started the SLMA list, naturally we did not have much knowledge in this. We also learned as we were going along. When we started, we actually just used the bulk mailing software. I think it was a normal bulk mailing software. But over time, we realized that the SLMA list is very important and it's actually giving importance to the membership. So therefore, what we did is, we actually purchased, and we are currently using also, very high-class, world-class software called MailChimp. It's not cheap. It's costing us about, I think, about 8,000 or 10,000 a month. But because it is a very good software, and because we are now following the double opt-in method, MailChimp generally does not go into the spam folder. It might. I'm not saying it won't, but generally you find, because MailChimp servers are well recognized as good, reliable servers, now we don't find the spam. So that's one of the ways that you can overcome that, is by going for very high quality mailing software.
Thank you, Dr. Rikas. I think we have Mr. Samira Vijayaratna from Dialogue available via voice. He has a question for you. Mrs. Samira, can you hear us?
Yeah, I can hear you. Probably some background.
If you have any questions.
Yeah, quick one question from Dr. Rikas. Doctor, thank you very much for your presentation. And now you said that you have got almost around 13,000 followers around you through this social media. Have you done an analysis to see how many of them are members of SLMA and how many of them are from the general public? Have you done such analysis?
Actually, Samira, no. Actually, to be honest with you, no, I have not done such an analysis. Partly the reason is, I think the SLMA mandate, when it came to social media, I think we were very clear at the start of social media campaign also, that the SLMA's mandate when it comes to social media was to serve the public arm of the SLMA, because we wanted the email list to be a point where we funnel all the allied professionals and health professionals into the email list. The email list, of course, we know that I think it's about 85-90% are mostly medical professionals, and about 10 to 15% are allied health professionals. But when it comes to social, no, we actually didn't do that. Perhaps that's something that we have to do in the future. But that was one of the reasons, is because we wanted more public participation, and we got that in the social space. But we haven't done that. That's the answer to your question.
Okay.
Mrs. Samira, any more questions?
No. That's what I wanted to answer from Dr. Rikas.
Thank you very much. Yes, thank you. Dr. Rikas, we have another question. This is from Dilip Oshadi. What is the cost associated with renting commercial bulk mail services?
Yes, I think I already answered that. I think if you go to mailchimp.com, you will get various. I mean, there's a lot of them. I mean, there's Mad, Mimi, and there are so many emailing softwares. But I think what we found is Mailchimp is quite good. If you are looking at, it depends on the subscriber base. I think Mailchimp allows you to send up to 12,000 subscribers free. For a certain amount of mails, like you can't send continuously, but maybe 4 mails a month you can send free if your subscriber base is less than 2,000. But when your subscriber base keeps on going up, it goes up. So at the moment, the SLMA, I think, is paying something like $75-80 per month for mailing.
Thank you for that. And I think we have our audience is really interested on the mailing solutions. We have another question on mailing. It goes as, why did you decide to go with the commercial bulk mailing solution as opposed to open source or FOSS solution?
Yeah, that's a very good question. I think there are a lot of good open source solutions, but the problem is that there is a problem of reputation when it comes to email server. That is that an open source solution cannot provide that, because actually open source is much more low cost. They are building it to a community, so they cannot look at things like whitelisting in servers. If you get blacklisted, what do? They are not able to cater to those things. So therefore, for example, what I'm going to say is there is no customer relation care behind that open source solution. Now, open source solution will be very good, naturally, it will be excellent. But the point is that sometimes it does happen that there are errors that maybe if we send many mails in a certain session period, then there might be some people complaining, saying to server companies and saying these people are sending a lot of mails, etc. It can happen. So in that situation, the open source solution is a standalone solution. It's giving you the solution, and that's it. If you want customer support, even as we know, even in open source, you have to pay for that sort of customer support maintenance agreement. So therefore, we found that, as you know, our president at the time was Sri Lankan. So he's a person who is always open source friendly and always pushes all of us to go open source. But in this particular case, we realized that customer relationship and also things like managing servers is something that are open. So that is why we decided to invest some money and go for a proprietary solution. I hope that answers the question.
Yes, we have another question. Do you get statistics of number of emails opened and clicks per email using the commercial mailing software you use for the campaign?
Actually, that is something I could not add in this. I don't think I have added it. No, I haven't added it, but it's like this. What Mailchimp said that our industry average, that is probably the American average, is 19%. I don't know how they are getting that demographic health, but I'm sure anybody who puts health in that. Maybe even the cosmetic industry who when they put a skin cream, it might be health. I don't know about that. But the Sri Lanka Medical Association's open rate was about 9 to 10%, right? Now, looking at the worldwide open rate, sometimes you find that the worldwide open rate is even less than that. When it comes to marketing, like when you're looking at, these people putting this anything.lk and this my deal and things like that, their open rates are even less than that, right? So our open rate, 9% was actually quite acceptable when looking at the worldwide standard.
Okay. We have one last question. This comes from Suchit Tilakaratna. When you are posting contents to social networks, do you use an automated method to post website content to social media, or do you do it manually for each platform? I'll repeat the question. When you are posting contents to social networks, do you use an automated method to post website content to social media, or do you do it manually for each platform?
Yeah, social media, we don't have the time actually to post to each and every platform. What we do is we use application called Buffer. Right, there is an application called Buffer. It's actually a social media publishing platform. You have to just log in and authenticate all your accounts, and once you authenticate it, you are able to send it. We actually use the application called Buffer. I can share it here. This is I think I just posted it. So this is actually the tool that we use. Yes, I just typed it in for more. Actually, that's what we use, and it posts everything. It posts to all the platforms.
All right. Thank you very much, Dr. Vikas. Since we have run out of time, we'll be concluding the Sri Lankan eHealth Hour for today. If you have any further questions to ask from Dr. Vikas Sharif, please feel free to forward them to us. We can forward all your questions to Dr. Vikas. We will make sure to distribute the resource materials and answers to questions to you via email. We would be grateful if you could also submit the feedback form we will be sending to you via email after this webinar. Please join with us for our next Sri Lankan eHealth Hour on 13th August 2015 at 12 noon. If you are an expert in health informatics and willing to share your experience with eHealth community of Sri Lanka, we can arrange your session at Sri Lankan eHealth Hour. Feel free to contact us. We are delighted with the participation for Sri Lankan eHealth Hour from all around Sri Lanka. Thank you very much for joining with us today. See you on 13th August. Bye-bye from Colombo.
Right.